ฉีด1
ได้ถึง
กับไฮบริดฟิลเลอร์ตัวใหม่ HACa ซึ่งเพิ่งเปิดตัวไปเมื่อเร็วๆนี้นะคะเรียกได้ว่าได้ถึง2ผลลัพธ์ในการฉีดเพียงแค่ครั้งเดียว
ซึ่ง Hand On Passion วันนี้เราได้รับเกียรติเป็นอย่างสูงมากๆเลยจากดร. แองเดรีย บราสของเราค่ะซึ่งเป็นแพทย์ผิวหนังผู้เชี่ยวชาญชั้นนำระดับโลกจากประเทศบราซิลกันเลยค่ะเพราะฉะนั้นวันนี้เราจะมาเจาะลึกกันเลยว่า HACa และ Duo Effect เนี่ยจะน่าสนใจขนาดไหนค่ะ
Hello, so welcome to Thailand. So I would ask you about the question like what's the inspiration of the development of HACa product? I know that you are like one of the very first person to know how it works and to inject like can easily say that you are one of the most renowned injector and what's the effect on the skin?
Okay, thank you so much. It's my pleasure to be here in Thailand again. I love Thailand. So yeah, it was very important because we have been using, for example, in my country, Hydroxyapatite as a biostimulator for a long time, like 15 years. But for the first time, we have a product, and I helped to develop Harmonica that is totally different because you have the Hydroxyapatite that is excellent biostimulator, but together with Hyaluronic Acid. Then we call a dual effect injectable filler, and because of that is the first and the unique to do that. So we don't need just to have to wait the collagen stimulation as a unique benefit. We have immediately after injection sustained lift because you have hyaluronic acid inside the product, and then in 1 month as a bonus effect you're going to have the collagen stimulation with maximum in 3 months. But the patient is very happy immediately after the injection, like we used to notice with hyaluronic acid like Juvederm, Volume and Volux. So because of that it's totally different and just a biostimulator and is amazing product. So I'm very happy to have to develop Harmonica and to have been launching around the world and now here in Thailand.
Okay, so normally for Thai, as a Thai patient, we are really into an aesthetic procedure. So for how can HACa address our common skin problem for Asian, for example, wrinkle, pigmentation, skin pores, or anything that.
Yeah, I think that because generally in Asia, you begin to treat the patient very early. You like the concept to prevent the aging process more than in Europe, definitely. In Latin America, we are very vain too about the treatment, but in Asia, you begin early. And in Thailand, it's the same because it's Asian Pacific, so it's the same approach. And because of that, again, it's very important to have a product that like Hydroxyapatite, that is a biostimulator, but with hyaluronic acid, because you're going to have much more than just a biostimulator. I have been noticed that, for example, the female patient here have a very hard shape, sometimes a round one. You don't like a lot of information in the lower face, you prefer more delicate. So it's very important to work with the collagen stimulation because of that. We have the lightening of the surface of skin will be much better when you have a biostimulator and the hyaluronic acid about the stretch the skin and will reflect better the light. So you have an action on the pigment, not to make more light, but because reflect more the light,
So make a pigment look lighter.
Yes, so it's amazing. To acne scar too is very good because have a collagen stimulation. And we have hyaluronic acid to stretch, to give a lift together. And because of that, you're gonna like too much.
So it means that it also helps for skin pores problem, right?
Yeah, not the biostimulator, but because the surface of the skin will be better and you have a lift effect with the hyaluronic acid, definitely gonna help too.
Yeah, wow, that sounds good.
for harmonica, for those who already listen to you that and they are like so into it, really want to get the injection, they might want to know like how's the interval between a session, because we do have so many different like biostimulators that you need to do it like every month and stuff. How is the difference?
Okay, this is a very important question. It's one of the most common in the country that I have been launching. Is because, okay, we have even having immediately effect very well after the injection because you have hyaluronic acid inside the product, but the collagen stimulation begin 1 month after, so 4 weeks after. And the maximal effect is generally 3 months after, sometimes 4 months. And because of that, I stimulate to wait at least 4 months to treat again. So the rule that I suggest an allergen accept is 6 months, because it's a good time to reassess the patient. And for example, if you reassess in 6 months, if the pinch test is still positive, you can do again harmonica. If the pinch test is not more positive, means that you have a good collagen stimulation, and you just need to put a little bit of volume. You can do just hyaluronic acid, or you don't need to do nothing. So depends on, but wait at least 6 months. If the patient have a biostimulator single treatment before, I stimulate to wait at least 3 months because it's the maximum of collagen stimulation to do harmonica,
So you mean it can also be combined with other biostimulators?
Yes, but because of collagen maximum come 3 months after, wait at least 3 months because to don't have a risk to produce too much collagen and have fibrosis, this kind of thing.
And since we already talk about like combination, is it also possible to combine with like machines or some other stuff with harmonica, or how long do we have to wait until that?
Okay, so the machines that can give a collagen stimulation to like a microfocus ultrasound, this kind of thing, I wait at least 1 month. Why? Because the hyaluronic acid don't like heat, no? And because the product have hyaluronic acid. So to do in the same day, I don't like because of that. If you have just a biostimulator alone, you can do with heat, but not harmonica. Harmonica I prefer to do or before, like a microfocus ultrasound or something like that. And then after like 15 days, 1 month, you do harmonica. But if you did harmonica before, wait at least 1 month to do microfocus ultrasound. If you do like just a mechanical thing like micro needling, is not a problem,
How about if we do it first? If we do the microfocus ultrasound first, how long do we have to
wait
wait?
1 month.
1 month,
Still
still 1 month.
Right.
Yeah, because the collagen stimulation of microfocus ultrasound will be different and not so risky about to have too much fibrosis. So 1 month you can do harmonica.
Still 1 month, right? Even before or after, still 1 month.
For example, if you have like things, just the surface, like IPL, like another lasers that is more surface, is not a problem, But everything that heat too much, and you have a risk to have absorption of hyaluronic acid, I wait at least 1 month.
I see. Thank you. That's very
Interesting to hear
nice.
that.
Right. And also, from what you said, I think it's very natural to let it lift, because it takes a while to get the change. So it means that basically, after you do the injection, you just look slightly more beautiful every day without people actually noticing.
Especially beginning in 1 month. Sometimes we see in 3 weeks the beginning the collagen. But the good thing is, the more one advantage of the product is because calcium hydroxyapatite don't give volume. Calcium hydroxyapatite just work on the thickness of the skin. The skin will be thicker and the ligaments will be stronger too. But we don't have risky to have more volume. The volume, the lift effect that you have is because of hyaluronic acid, and the notes immediately after, and you have the control what you are doing because you'll be immediately after you have the result. But after this, the collagen stimulation, you will reflect in the touch of the skin, the thickness, the pinch test will be negative, but it's very well controlled, very safe about that. And the patient generally, even if you don't say anything, the patient will come back, they're gonna say, Dr. Braz, I love the last product that I'm injecting me because we noticed improvement each month. You'll be better.
The longer, the more beautiful, right?
It's very safe and amazing result because of that.
In your experience, so how would you choose the good candidates or bad candidates, or what should we avoid or a precaution before an injection of HACa?
In this case, because we have calcium hydroxyapatite and hyaluronic acid together, generally we work with the age of the patient, and we work with of course, the aging process, and then the assessment. So the assessment is very important about the pinch test because we show that the lax skin and the necessity to have a collagen stimulation. Of course, the assessment, the dynamic movements, when I ask the patient to smile strongly, to do this, and because you're going to see the wrinkles, the accordion lines, and this kind of thing, it means that you need to restore the loss of volume, lift effect, and have a collagen stimulation. And then the facial shape too. For example, the heart shape, aging much more here than here. So this kind of patient, definitely you should act more in the inferior part than here. About the age, we know that you begin to have loss of volume in 35 years old in female patient, but here I know that in Asia again you begin early. So generally 30 years old you can begin to treat if you will not have wrinkles there, but if you have pinch test positive, you can begin. But before this, no, because generally you don't need still to have a collagen stimulation. So doing these factors, you're going to have a good candidate to use harmonica.
So actually this kind of test patient can even do by themselves to examine their body like at home to check if they still need
if they think
like can
that
do
they have
pinch
a lax
taste
skin and this kind
and
of thing.
try to smile.
Yeah,
and
but
see
then
at
the
mirror.
physician should confirm that or not because we have more experience to choose the right treatment and this kind of thing. Okay.
How about the safety profile? I know that it is like FDA approved and you have been using it for many years. Is there anything at all to be concerned as a patient to be like injecting with harmonica?
You mean to avoid complications?
Yeah. Is there anything?
No, this is very about the technique. The assessment, the amount per area, the retrograde technique. This is a very technical thing to the physicians that gonna inject. If they follow the rules, an experienced physician like you, the patient will not have problem.
วันนี้นะคะเท่าที่เราได้ฟังแล้วก็ได้ hand on จากดร. แอนเดรีย บราสซึ่งเรียกว่าเป็นตัวจริง
ใช่
เป็นผู้เชี่ยวชาญของจริงแล้วเนี่ย
ขนลุกอ่ะ
เนาะดีมากอ่ะ
ดีมากเทคนิคดีมาก
ใช่ค่ะแล้วก็ดูอเอฟเฟกต์เนี่ยเห็นผลเลยทันทีส่วนหนึ่งไม่พอกลับบ้านไป
สวยขึ้นไปอีก
โอ้แบบสุดยอดจริงๆนะคะก็ถ้าเกิดว่าใครที่สนใจนะคะดร. แอนเดรีย บราสก็ได้พูดจบไว้เรียบร้อยแล้วว่าอีกข้อหนึ่งเลยที่อยากจะฝากไว้ก็คือเราจำเป็นจะต้องฉีดผลิตภัณฑ์ที่ถูกต้องในสถานพยาบาลที่ถูกต้องและที่สำคัญแพทย์ต้องได้รับการเทรน
ใช่ถูกต้องก็อย่างวันนี้เนาะเราก็ได้รับเกียรติมากๆเลยจากดร. แอนเดรีย บราสของเรานะคะที่มาเทรนให้เราตัวต่อตัวเลยเนาะ
ถึง Apex ของเราเลย
เพราะฉะนั้นแพทย์ทุกท่านที่นี่ได้รับการเทรนมาอย่างถูกต้องแล้วก็รับรองว่าผลงานใช่ถูกต้องค่ะเพราะฉะนั้นนะคะใครที่อยากจะมาอัพผิวแน่นกับนวัตกรรมคูณ2อย่างเรานะคะวันนี้ก็มาเจอกันได้เลยค่ะที่ Apex
สำหรับรายการ Hand on Passion ของเรานะคะเอพิโซดหน้าจะเป็นใครนะคะน่าสนใจขนาดไหนอย่าลืมติดตามกันนะคะ
ค่ะสำหรับวันนี้เรา2คนเนาะหมอเอิญก็ต้องขอบคุณดร. แอนเดรีย บราสมากๆนะคะขอบคุณค่ะ Thank you so much we learn a lot today ติดตามกันใหม่ EP หน้าค่ะบ๊ายบาย